a patient's outcome by using the skills of doctors, lawyers, social workers, and academics. The Wishard Medical Legal Partnership for Patient Health offers specialists from these different programs to advocate on behalf of patients. Here to tell us more about this program is Anna Kirkman, an attorney who leads this effort, and Dr. Deanna Reinoso, a pediatric primary care physician at Wishard's PCAR Health Center. Our phone lines are open. If you have any questions for Anna or for Dr. Reinoso, please call 317-239-1310. That's 317-239-1310. Anna, let's begin with you. This just sounds like a really unique program that there can't be very many of them in the country. So why was this program started at Wishard?
Well, good morning. The Medical Legal Partnership started at Wishard in 2008 as a result of Wishard's CEO and medical director, Dr. Lisa Harris, having read about the model. Dr. Harris believed it would be an innovative opportunity for patient advocacy, and Wishard's chief legal counsel, Jessica Barth, believed the same, and shortly after that, the program launched at PCAR Health Center. Now, the Medical Legal Partnership Model, or MLP as it's sometimes called, it actually started in Boston in 1992 when a pediatrician kept seeing one particular patient, an asthmatic child, over and over again. And despite prescriptions and breathing treatments, the asthma continued to worsen. The doctor then learned that the family was living in substandard housing, and there was mold growing in the family's apartment, and that was actually exacerbating the child's asthma. So the doctor decided to write a letter to the landlord. Well, that was not responded to. So then the doctor called his personal attorney and said, would you mind sending a letter to this landlord, letting them know that this is inappropriate and affecting the child's health? And as a result, the landlord then remediated the conditions. So that actually planted the seed for the Medical Legal Partnership Model. And from that grew the idea that legal advocacy could be used to impact patient health.
And Dr. Harris is so innovative, and there are so many programs that are first in the country for Wishard Hospital. Okay, let's go to Robert on our phone line. Do you have a question for us, Robert?
I do.
Okay, go ahead.
I'm participating in the Wishard Advantage.
Oh, okay.
I was out there at U-Haul on 56 in Keystone a couple of weeks ago on sales, coming out of the car, slipped on one of their signs. I called, I had a claim written. Their insurance agent called me the other day and told me they wasn't liable. I didn't know the Wishard itself had the program. I was trying to send the bill to them since I saw it on their copy, but they're telling me they're not liable. Can someone help me there?
Yeah, good morning. This is Dr. Reinoso, and unfortunately I'm a pediatrician, so that's more my area. But, our medical legal partnership is a partnership really not to deal with all legal issues, but specifically to deal with legal issues that are impacting the health. So sometimes, when we think of legal issues, we think more general of some of the things that we deal with. And I'm sure that maybe we can somehow find what department, but this specifically is a partnership for health issues that would be sort of more environmental issues or those sorts of things. So I am so sorry that you fell on the ice, and hopefully I'm not sure if you could call back later or how we can work that out, that we can find where you would need to contact. But this partnership is a little bit different focus than those sorts of legal issues.
So no one, if I was injured, no one there could help me?
I believe that there is a department for that. If you can give us your phone number off air, then we will get you to the correct department that you need to call. Our medical legal partnership, as you continue to listen to the show, has a little bit different focus, which is more specifically with health-related outcomes as far as the environment and other issues that affect health.
Okay, fine. Thank you.
Yes, thank you, Robert, for calling. And as you listen to the rest of the program, I think you'll probably get a little bit more of a better understanding of what the medical legal partnership and how it really operates. And that, thank you for calling. And that was going to be one of my questions: is how do patients tell the difference between, do they ever confuse what the partnership is all about and confuse it with other legal issues that are really not related to health care, but or to them getting the proper health care, but using it as a legal aid?
Yeah, so I think the medical legal partnership provides a lot of opportunities for advocacy. So really the focus is, how can the social worker, the physician, the attorney work together to advocate for a patient? And that can be in the realm of issues with benefits. It could be in education. It could be with housing issues. It could be with food insecurity issues, guardianship and family law, immigration, domestic violence. There's a lot of opportunities for focusing on patient health through advocacy through the medical legal partnership.
Okay, which is just this is a great follow-up question. Who or what determines if the medical legal partnership gets involved with a specific patient's care?
So the Wishard clinics that have the medical legal partnership, which would include the Picard Health Center, the Primary Care Center at the hospital campus, North Arlington Health Center, and Midtown Mental Health locations, at those locations, the doctors, the nurses, and the staff, they've been trained to actually screen and more or less triage for patient legal needs. There's also some posters hanging up in some of the exam rooms, and that can really help facilitate conversation about these issues.
Oh, okay. And do you believe that the medical and legal, by them working together to prevent or overcome any non-medical problem, how will that actually, or will it impact health?
Well, our medical legal partnership is extremely valuable and often really central in being able to provide a good health outcome for our patients. So really, as a pediatrician, I've come to recognize that giving family-centered care that really considers a person's culture and social needs and the environment they're in is what's essential to being able to provide good health outcomes. So that, necessitates that we work together really as a team in partnerships like our medical legal partnership to allow us to meet these healthcare needs that we see for our families coming in.
So do you have people who come and can just actually walk in and say, I want to talk with a representative from the medical legal partnership if they know about it? Can they do that and then they get into the system that way?
Yeah, I think, part of the responsibility is for us as medical providers, as physicians, to really recognize the importance of this. The example of a child with asthma, the traditional model is to give the right medications and give the child oxygen if they need, but really thinking more in a global, comprehensive way of what the environment is and how to help with that. So we often will recognize certain situations where we see that there would be a value to a medical legal partnership. And then patients themselves, I really encourage families to think about their environment and issues that they realize are affecting their family's health, because it's something that their primary care doctor wants to hear about. And so we do our best to try to, find out from families and make the referral. But also families can advocate for themselves, their families, their children, by realizing that there is an environmental issue or, a family issue, a social issue that's making the health complicated for their family or their child.
And I think sometimes patients will have documents, legal documents even, eviction notices, maybe a letter from the school, a Medicaid denial, that they don't quite know what to do with. And so sometimes they'll bring that to their physician and ask for help because they're not sure what they can do with that. So sometimes the issue is very clear and the physician knows immediately to engage the medical legal partnership attorney. Other times, I think physicians notice trends in legal needs of certain patient populations. So a particular example of that was the Deferred Action for Childhood Arrival program. That was an executive order started last summer. And that is an opportunity for young undocumented individuals who came here at a young age to apply for a certain status and have the opportunity to work. And so physicians who see teens and adults who might be eligible for that, they really sought out information so that they can be prepared to help patients understand what their opportunities might be. So you have some situations where patients are bringing their needs to their doctors, and other situations where doctors are becoming aware of certain opportunities and then are ready to have that conversation with the patient.
Oh, okay. So in many situations, individuals cannot, on their own, successfully challenge the unlawful actions of others, such as landlords, big government agencies, and that. Do you have concerns that many will use this partnership to solve the legal issues not associated with health care?
I think our concern more is, there are times where it doesn't fit for what our partnership is able to help with. Our concern more is that families won't get help for some of these needs and won't recognize that it's affecting their child's health. So, an infant that comes in with multiple bed bug bites, and the family is coming to me because they want a cream or because they've become infected, they're not recognizing that they can get help for some of their housing issues. So I would much rather have families, share their concerns and be able to help them and refer them. And sometimes it is outside the scope of what the partnership is able to assist. But really what the partnership is about advocacy, advocating for better health outcomes for things that aren't a prescription that we can write to help solve families' health needs and medical concerns.
So just helping them make that connection with another outside agency really is beneficial to that patient also. And I loved your comment, Anna, about the asthmatic child. I mean, who would have ever thought that asthma in the home could be solved through a legal issue and not just strictly medical issue? So, I mean, it is just, it's an amazing partnership. How common is this type of program throughout the United States? You mentioned that it came, or one of you did, mentioned that, it was patented after or programmed after a Boston program.
Yeah.
Are there other programs throughout the country?
There are 97 actually medical legal partnerships across the United States, and those 97 medical legal partnerships actually serve 275 hospitals and health centers. There's also a National Center for Medical Legal Partnership, and that's an organization that helps cultivate relationships among doctors, lawyers, nurses, and social workers, and that offers resources and programming. I think that it's a service that could become potentially more common as the patient-centered medical home model becomes a more popular model for the delivery of health care. So the patient-centered medical home is a model that focuses on coordinated care among different providers in an effort to really treat the whole patient. And so you think about treating the whole patient, that could include mental health, that could include dental, that could include financial counseling, dietitian, exercise, and potentially legal. And so as we look at all the different ways in which we can impact patient health, and we understand that legal advocacy is part of that, I think it may become a more common program in health centers.
Oh, okay. So how does this program differ from other forms of legal aid that we have throughout the country?
Well, legal aid is, we have partnerships with legal aid organizations locally here, but the difference between the medical legal partnership and just a standalone legal aid organization is that we're actually collaborating with the physicians, with the social workers and nurses. We're getting the patient's story in a different way. And then the patient also has access to legal services in the health center where they're seen by their doctor. And they trust the physician's referral to go talk with the lawyer about an opportunity for legal intervention in a way that really improves their health.
Oh, where does funding for this program come from?
These programs are largely grant funded. So we seek out federal and local funding opportunities to help support our programming. We have partnerships with Indiana Legal Services, the Neighborhood Christian Legal Clinic, and a private law firm in town, Fakery Baker Daniels. And they really have this emphasis on pro bono opportunities for their attorneys. And so a lot of those attorneys will provide end-of-life assistance or guardianship assistance when they're incapacitated adults. So we leverage different community partnerships to provide these services.
Okay, well, it sounds like we're going to have both of you back to talk to us for the whole hour so we can get all this information. It's a really neat program. Thank you so much for coming in today. Anna, thank you. Dr. Reinoso, thank you for taking your time out for coming in with us this morning to talk to us about this really important program. Another